how to put in a risk report. Some things you need to remember when putting in a risk report. There is a training site to where that you can go in and put in training or risk reports that are just for your practice, so you can get used to actually doing that. When you do that, your username and password will be train me in all capital letters. When you log into the intranet and select the risk report system icon, this is going to be the first screen that you see. And the user ID is going to be your employee number, and your password will be password. The next screen that you'll see is how to select your occurrence type. There's 3 different types of occurrences that you can choose from: complaint received post-discharge, non-patient visitor occurrences, or patient registered occurrence. If you select a patient registered occurrence, that is for anybody that is still in the hospital, that is in the long-term care unit, or is an outpatient, getting an outpatient service. So the next screen you see is to select your facility. The first facility that's going to show up is the one that is going to be tied directly to your facility that you're assigned to. So if you are assigned to Hampshire Memorial, that's the facility that's going to show up first. But you can select from the drop-down any of the other facilities if it doesn't pertain to your home facility. For a patient admission, if you're doing a patient registered occurrence, you will have to select the patient's name. If you select in the box there, put in the first 3 letters of the last name and hit search, and then that will bring up the patient's names, and you can select from there. As you can see, it has it here. What is different on this system than most systems is that the occurrences are in chronological order from the first visit to the last visit. So if you have somebody that's been here multiple times and it's their last visit, you might have to shift through pages of their name in order to get the right data service. If you cannot find the patient's name, you can do the add a patient, and then any of the information that is marked with an asterisk is the information that you would have to find out or enter, and that's just their first, last name, their date of birth, the date of service, and I think that's basically it on that. There's just a few asterisks there that you have to fill out. The next screen you see is the building site where the incident occurred. You can do from the drop down, and it'll have whatever areas are pertain to your facility or the facility that you selected as where the occurrence happened. You'll notice that some of our selections here have the red asterisks. Those are ones that are required. You have to fill them out in order to complete the report. The building site where it occurred, you notice, does not have the red asterisks. So if you don't know it, it's not that big of a deal. But if you do know it, put the information in. The next screen is a required screen, and it is the department involved. And if there's more than one department involved, just put the main department, and then when you fill in your description of the event, then you can add your other departments in there. The department rating, this will automatically default back to whatever department that you're assigned in, that your employee number is attached to. Mine would be automatically attached to administration. So that would be how it is. Now, if you work 2 different departments, some of the nurses happen to have 2 positions and work 2 different departments, they may have to change it depending on which department that they happen to fall in. The date of occurrence, a calendar will come up and it'll be the date that's there. If you're doing it in real time, that is fine. If it happens to be something that had happened like 3 months ago, go ahead and put today's date or the date that you're entering the report in, and then make sure in your description you could put in the date that it actually occurred. The time of occurrence, if you know the time that it happened, put that time in there. If not, I just put whatever time it is that I'm putting in the report. The occurrence category, you have different categories. You have behavior related, complaints, environmental, equipment related, falls, instruments, medication related, or practice procedure related. So whatever it fits into the best category there is what you're going to select. For an occurrence subcategory, you're going to choose the best subcategory of the occurrence. And again, you have many different options here on what you can choose. Just choose whatever's best. And if you have questions on what is best or where it should go, you can contact me and I can help you with that. The exact location and room. Again, this is not a required piece of the report, but if you do know the exact room, it is best to put it down there, because then that gives us some place to start to actually go back and work with what our follow up on the risk report. Physician notified. This is a required field. Even if the physician is not directly involved in what's going on, if it is an inpatient, an outpatient, long-term care, go ahead and check yes to this and put the physician's name, their primary physician's name in there, because somewhere in our investigation there may be a point where we have to go to that physician and let them know what's going on or obtain more data for our report. The next field is, it says if the physician was notified, and you're going to put yes. Put the last 4 letters of his last name in there and hit search, and then you can select from the list of what physician it was that is the primary care for this patient. The occurrence description of what happened. You're going to describe what happened. Be as specific as possible about what has happened. As much information as you can give us is better to help us with our investigation. There is no character limit in that space, so you can put as much as you can possibly put in there to help us with that. Was injury noted? Yes, no, or unknown. Was there equipment or medical device involved? Yes or no? If you mark yes on the medical device, make sure you have, there's a sticker on all of our medical equipment that has a login number. If you put that it's a medical device related, you have to have that sticker information when you put that in, so they can go and pull that specific piece of equipment to pull it out of service. Any additional witnesses? Again, this is required, and you would put yes or no. On this, if you select yes, you will get, you'll get another screen that will have you pull up who your witness was. If it's an employee, you can search for that employee's name, and there will be a drop down. You can select the employee's name and be able to select the employee right on the sheet as well. Date immediate action was taken. If you did something immediately to help with this occurrence that has happened, if it was medical equipment related, if you went in and you pulled whatever it was off of the floor yourself, or if it was a fall, you notify the emergency room, or if it's a patient that's up on the floor, you called the nurse, whatever. You would put the date that you did that, and then document what the immediate action was that you've taken. The system will prompt you to save your work. Once you save the work, you cannot go back in and change it, okay? But in order to save it, you would just click the save up there at the top. This will give you a way to preview your report. And this is where it's been submitted. This will go to, it goes to risk management, and it will go to whoever the department manager is involved. So if it's in the emergency room, it'll go to the director of nursing of the emergency room. If it's housekeeping, it'll go to their supervisor. So whoever that department is that is involved is the people that will get this report initially. That's how you put in a risk report.